How have emergency protocols for acute diverticulitis changed? Imagine a time when every case of diverticulitis meant a hospital stay and a round of antibiotics. That has shifted quite a bit in recent years. Now, doctors are taking a more careful, evidence-based approach to managing this common condition. For uncomplicated diverticulitis, which is when the infection is limited and there are no signs of widespread infection or perforation, the protocols have become less aggressive. Instead of automatically prescribing antibiotics, many patients who are stable and have no immune system issues can be treated with supportive care alone. This means pain relief, rest, and a special diet, often starting with liquids. Antibiotics are now reserved for those with higher risk factors, like weakened immune systems or signs of systemic infection. Another big change is that many patients with uncomplicated diverticulitis can be treated as outpatients. They can take oral pain medications like acetaminophen or ibuprofen, follow dietary modifications, and be closely monitored by their healthcare provider without needing to stay in the hospital. This approach helps reduce healthcare costs and hospital stays without compromising safety. For cases where diverticulitis is complicated, such as when abscesses or localized infections are present, intravenous antibiotics are still necessary. In some cases, if an abscess is larger than 4 centimeters, doctors may perform a minimally invasive procedure called percutaneous drainage to remove the pus. This technique often avoids emergency surgery and speeds up recovery. Surgical strategies have also evolved. Instead of automatically performing a procedure called Hartmann's operation, which involves removing part of the colon and creating a colostomy, surgeons now often prefer primary anastomosis, where the healthy ends of the bowel are reconnected, especially in carefully selected patients. This can improve quality of life and reduce the need for a permanent stoma. Laparoscopic lavage, which involves washing out the abdomen without removing diseased tissue, is generally not recommended anymore because studies show it can lead to higher short-term complications. Additionally, the idea of doing preventive surgery after an episode of uncomplicated diverticulitis is no longer routine. Instead, decisions are personalized, based on the patient's overall health, risk factors, and preferences. Imaging plays a crucial role in these new protocols. Computed tomography scans are used to confirm the diagnosis and assess how severe the diverticulitis is. The classification systems like the Hinchey scale help guide treatment decisions, distinguishing between mild and more severe cases. For the most serious cases, such as those involving perforation or widespread infection, patients may need intensive care, including admission to the intensive care unit, to manage the higher risks involved. Overall, emergency protocols for acute diverticulitis have shifted from a one-size-fits-all approach to a more nuanced, patient-centered strategy. This means fewer unnecessary hospital stays and antibiotics for uncomplicated cases, targeted interventions for complicated cases, and more reliance on imaging and classification systems to guide treatment. These changes aim to improve patient outcomes, reduce unnecessary procedures, and make healthcare more efficient, all while keeping safety front and center. Remember, always consult with a healthcare professional for personalized advice, as each case can be quite different.